Hello, I'm Dr. Augustin with Bayside Chiropractic and Rehab. And what we're going to do today is talk a little bit about carpal tunnel. First of all, what is carpal tunnel? Well, carpal tunnel is a compression on the median nerve in the wrist, usually right about here in this area. And what causes it is it's a repetitive motion injury. Working on a computer all day long, doing the same thing, all day long. Certain jobs, it's very common. It's very commonly work-related or task-related if you're doing the same task every day. What kind of symptoms do you have? Well, the main symptom is it usually starts almost guaranteed you're going to have numbness in these two fingers. If your pinky's involved, not usually carpal tunnel. That's another nerve. But if you want your index finger is involved, that's usually definitely. Sometimes you'll have all three with half of the fourth digit involved. That's the textbook carpal tunnel. How do you know you have it? Well, it starts with numbness and tingling. And most people say it's much worse at night. So it becomes painful. So usually when they say it wakes you up at night, these three fingers are tingling and it's painful, it can become painful, that's a sign of carpal tunnel. So how do we diagnose carpal tunnel? Usually an easy exam, which only takes a few minutes, will give you the diagnosis of carpal tunnel. Sometimes you might have to get some x-rays taken. There are some other types of conditions which aren't carpal tunnel but affect the median nerve, so we have to rule them out. So now, what can we do with carpal tunnel? Well, one of the simplest things to do is adjust the wrist as far as chiropractic is concerned. A lot of times the carpal tunnel, basically what the carpal tunnel is, it's just a little pathway of the nerve through this area in the wrist, and it's got a bunch of tendons around it, and it's a very small area. And if you have repetitive trauma, what happens is sometimes you get some swelling in the wrist in that area, or you get a bone that shifts just a little bit, and you start having carpal tunnel. So most of the time, conservative treatment will heal carpal tunnel. Now, if you go on for too long and carpal tunnel becomes chronic, and I'm talking 3, 6 months, a year, you can start noticing that your palm, the part underneath your thumb, may become smaller. Now, that's a more serious sign because now you're getting muscle wasting. And what you'll notice is the strength. If you try to pinch your thumb and your pinky together, you can't hold them together anymore. So it starts getting weak. Now that's more serious, and that can be a little harder to treat. So how do we treat it? We use therapies such as the laser, adjusting, ultrasound therapy to decrease the inflammation and get the wrist moving properly. That'd be the initial treatment. Exercises to decrease the tension in the forearm and to help with the tendons in there if you've got a tendon that's, swollen or inflamed. Most people do fine. Now, if it's chronic and it doesn't heal, then sometimes surgery is an option. But you have to remember that with that surgery, you're only increasing the size of the tunnel about 7%. So you really want to, it can be a failed surgery. So you really want to look at all the conservative treatments before you go to carpal tunnel surgery, because it may not work because you're only getting a little more space with that surgery. So you really want to try everything else first. And we'd be more than happy to answer any questions. You can just give the office a call and we'll answer your questions or make an appointment and have an evaluation done if you're suffering these symptoms, especially if they're getting worse when you're sleeping. Couple of things to remind you of. We are currently having a special on our weight loss program where we're taking $100 off for a single individual. And if you come with a partner or an accountability partner and you do the weight loss program together, I take $150 off each of your programs. We'll extend that special till the end of February. If you have any questions, don't hesitate to call the office. You can ask to speak to me. If I can't talk to you right away, I will call you back. The number for the office is 251-990-8388. Thank you.